You just kind of describe to me what feeding challenges you and were experiencing with your baby before treatment. So maybe symptoms that your baby was having and symptoms that you were having.
So definitely, we were having latching issues. She wasn't getting a good deep latch, so her suck, swallow, breathe rhythm was off. So she was taking in a lot of air when she was feeding, so that made her spit up a lot. Milk would leak from the sides when she was nursing. She was very tight in her neck and her back from overcompensating. Um, so that was kind of the
How about
biggest.
symptoms for you? Did you notice anything for you particularly?
Definitely pain when she was nursing. That seemed to get a little bit better after we started the myofascial therapy.
Mhm.
So,
Good. And do you want to speak to that experience a little bit with the myofascial therapy?
yes, we learned a lot with myofascial therapy. Liz was great. She went through everything in depth. The things that would happen later down the road if we didn't take do intervention now. She was very thorough in showing us exactly how to do each stretch and how long to do it for, that kind of thing. So she was really good about that. So
And what did you notice from your symptoms in the beginning where you started myofascial therapy before you even came into our office? What kind of changes were you noticing already just from the initial therapy that you were
sh-
utilizing?
yes, she was getting a little bit better with her latching. It wasn't perfect by any means, but it was definitely, you can tell that her top lip was getting a little bit stronger where she could kind of flange it up a little bit better to get a better latch. Her tongue, she kind of found her tongue, was able to stick it out a little bit further.
Mhm.
So,
Good. You were noticing some of those things.
yes.
So before you were actually going through the therapy, before the release, how was breastfeeding affecting you, like physically and emotionally?
It was definitely a struggle. We fed a lot. It was probably every couple hours, 1 to 2 hours between feeds, just because she would spit up so much after each
Mm.
feed. So that was honestly a little bit exhausting and kind of gives you a little bit of anxiety too when she's going to need to eat again. You can't space it out, every 4 hours or every 3 hours. It was pretty demanding,
Mhm.
honestly. So.
When did you realize, like during your experience, specifically, when did you realize that something might not be going well with feeding?
So definitely the spitting up, but she was also very tense. She had a fight or flight response, so her body would stiffen and she would kind of hold her breath and get red in the face. So I mentioned that to our pediatrician, who then asked more questions and was able to determine that she did have the tongue and lip ties and sent us on. So I'm very grateful for her as well.
Yeah, fantastic. That's what I was going to ask you, just kind of what you tried before finding our office and how you heard about our office. And essentially, was the referral made to our office, or what made you decide to come here for your evaluation?
Yeah, so my mother-in-law, she works in the dental field, and so she kind of asked her boss what would be the best place, and they said you. So that is how we found you.
Fantastic. Um, you mentioned that the other providers that referred you before finding us. So, kind of just a little bit about that process specifically. So, you expressed concern, your provider recognized that you had concern and kind of sent you in the direction of this way, this office, or
Yes.
just to kind of, I guess maybe how specific they were just sending you to find someone and you reached out to your mother-in-law. Kind of talk to me a little bit about how.
So my mother-in-law was actually at the appointment with us at the pediatrician. We had done all three of our kids at the same time, so she had come to kind of help get all the kids in the room and that fun stuff. But then once I had told her um, the fight or flight response and that kind of thing, she started asking more questions, looked inside of her mouth, was able to kind of recreate that fight or flight response. So was able to see that her neck was super tight. She saw the lip tie. Um, I explained the spitting up and that kind of thing. So she then said, okay, let's try myofascial therapy and definitely find somebody who can do the laser and not just cut the ties. She was pretty not adamant, but pretty you know, suggested that we do
Mm,
laser over the cutting just because it had a better outcome.
mhm.
So,
Yeah, yeah. What were your biggest concerns before your appointment here?
um, I don't know that I had many concerns. I was just hoping that we could get things fixed
Mhm.
and get her better at dating and not spitting up. And
Yeah, it sounds like you had
yeah.
great people along the way to kind of
Yes,
encourage you
yes,
the whole way through. Um, did you feel listened to and supported here at our
yes,
office? Yeah.
yes, definitely. Um, I, with my first kiddo, we knew that he had a tongue tie at the hospital, and so they clipped that. So I've asked with every child since. They told us that Hadlin did not have a tongue tie. So after hearing that, like, okay, maybe she just spits up, you know. So um it was just nice to feel validated by you and by Liz and our pediatrician that, okay, no, maybe you need to look a little further, a little deeper into why things are happening. So, yeah.
For sure. Um, was there a way, or could you kind of describe just how we operate here? Was the procedure explained in a way that made you feel comfortable, and what helped you maybe ease your anxiety about the procedure?
Yes, it was very thorough. I feel like you did a good job of like going through each and every step of the process, which I liked in the getting the diagrams of aftercare. Also, I think that was what I had the most anxiety about, just making sure that I was doing a good enough job at the stretches and all of that once the procedure was over. So,
Great. So, kind of some things we just spoke about a little bit, but what changes did you notice after the release, and how quickly did you notice an improvement in feeding?
within 24 hours, um, my husband said that he could tell she was a lot more calm, just more satisfied after eating. She wasn't as fussy after feeds, a lot less spitting up, still a little bit, but definitely a lot less than normal. So that was good. Yeah.
Immediate changes. Nice.
Yes, yes, it is.
How about you for you in the sensation of how has breastfeeding changed since the procedure?
It is a lot less. And I kind of got used to the pain, but it's not as uncomfortable as it was. Um, you can definitely tell when she gets a really good latch compared to the way she used to. Um, it there's just not as much tension in her mouth, and so I think that helps just feel a little bit more relaxed while she's nursing.
Yeah, that's a nice feeling for
Yeah,
you.
it is.
Um, and you just kind of spoke to how much more comfortable and content that she's been. I guess demeanor wise, he's comfortable because you were talking
Mhm.
about the tension in general, but how have you noticed that she seems more comfortable or more content since the procedure?
Yes, so just her body language, she just seems a lot more loose and relaxed in her body movements. We had her chiropractor the day after the procedure. And so we went and saw Heather, and she was amazed by how loose she was compared to the previous time. Um, Her head movements don't seem quite as stiff,
Mm.
they seem a little bit more relaxed as well. So, just overall, her whole body just seems just relaxed and not so tense.
Fantastic. Um, how would you say, or what has surprised you most since treatment? Is there anything that surprised you that you didn't expect or that you didn't know, or things that have come from that?
Um, Definitely that the tongue ties are um they're connected to lots of other places in the body. So even just the tenseness and her being more content um has been interesting just to see even in the last week. I mean, she was getting better with the myofascial therapy, but after last week it's night and day different almost. So
Yeah, that's great. Um, and then what would you say to another mother who is struggling with breastfeeding? Like, how has this affected you as a breastfeeding mother? And what would you say to another mother that's struggling?
Definitely push for answers or push to see, does this hurt? Whether you find a lactation consultant or a different pediatrician, somebody who listens and goes above and beyond to help you and not just dismiss your concerns. So,
Great advice. What would you tell parents who are nervous about getting an evaluation as a whole?
it doesn't hurt to get an evaluation. You can always choose a different path, but at least you know one way or the other if there is something wrong or not.
Yeah. And what would you say to a medical provider, to a new mother who might see that provider about her breastfeeding experience and concerns with it?
Definitely check those things. Check the lip and the tongue ties and listen and don't just dismiss those concerns and send them on if you're not comfortable with that area, you know, if you don't know much about it, send them to somebody who does.
Great. Thank you. Okay. And so the very last thing I'm going to ask you is if another mother that was listening to this audio feels exhausted, discouraged, or overwhelmed with breastfeeding struggles, what would you want her to know?
To keep trying. It's hard. It's exhausting, but it's well worth the bonding and just being able to give your baby that nourishment that your body was meant to do. When everything works like it's supposed to, it's just a really nice, really good feeling to be able to do that. So,
Great. Thank you.
yeah.
Anything else that you want to say or share? I asked you lots of
No,
questions.
so
Thank you
yeah.
for being willing.